I'm in a place now, 13 years later, that I can say that cancer was the teacher that I never knew that I needed.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I have a long-awaited guest from my viewpoint, meaning I've wanted to have her on since I've met her. This is Dr. Ni-Cheng Liang. She is many things, some of which are a pulmonary and integrative medicine physician, a mindfulness teacher, the podcast co-host of Mindful Healers, and she also creates wonderful retreats, which we'll hear more about. And she is a cancer survivor. And I know I've missed something. So before we dive into that, Ni-Cheng, thank you so much for joining me.
Thank you so much for having me. And that's pretty much my identity in a nutshell. But one of the main ones that's consuming a lot more of my time these days is mothering.
Mm-hmm.
Mothering a teenager and mothering a transitioning kindergartner to first grader. Um, so, yeah, but happy to be here. Life is full, but good.
Full, but good. And so you give a little bit of a scoop, and I understand that I am not a mother, but I understand, I think mothering and being a physician, one of the hardest things that many people say that they can ever do. Can you share a little bit more about what it's mean to be a mother and a physician?
Yeah. Uh, the two identities kind of meld into one. Like I am both at the same time. And so there's this work life juggling that I do every day. There is protected time for both aspects of my being, but sometimes it gets really muddled. And I want to say that the muddling becomes unexpected, and yet there is now an expectation for when the muddling occurs in an unexpected way, if that makes sense. Kind of
Mm-hmm.
like getting comfortable with the uncertainty or discomfort. And yeah, and mindfulness has helped me through those two identities and the muddling aspects of them day to day.
And I love to hear more about how the mindfulness has helped you, and especially even to people who might be new moms, any kind of lessons that you might help provide to support them on their journey as well.
Yeah, so mindfulness is paying attention on purpose to the present moment without judgment. And a shortcut definition that I like to use is it's the practice of allowing for the mind and the body to be at the same place at the same time. And so when we are in a nurturing caregiving role, so it doesn't even have to be mothering, it could be being a physician, or being a caretaker to an elderly parent or a friend or other family member, for instance. Being in the moment with them is probably the most precious gift that you can give to them, and also for yourself too, because that's time together in that particular moment is the only time that you have with them that is just like that, because every moment is different.
Mm.
To, I think, place a priority and a value to that kind of presence with another human being makes for a much more full and rich life, despite all the peaks and valleys that we have in life, the full spectrum of living.
And was there a period of time in your life before, you were just become, whenever I think of you, I think of your mindfulness, and it just seems like something that is you. And was there a time that you can recall, before that you really cultivated these skills and expertise in mindfulness? How is life different?
So I delineate my life in AC and sorry, AD and BC terms. So my pivotal moment in my journey with mindfulness started with my cancer diagnosis. And that was just recently. Actually, I celebrated my 13th cancer anniversary.
Amazing. Amazing.
And the cancer journey was really the catalyst for me to start a serious contemplative practice, even though I had been born and raised Buddhist.
Mhm.
So before cancer, so I was diagnosed when I was 31 in my second year of pulmonary critical care fellowship. And before then, I was going 200 miles an hour, didn't care about duty hour restrictions because we had just had them implemented during my intern year a couple of years before that. I was going to stay and get the work done and give 200%, but my body really was the one that said, whoa there, lady, like you can't keep doing this the way that you are. Otherwise, I'm literally going to put you in the ground. So it was a very scary and dark time for me. Went through a year of 5 months of chemo and then 3 surgeries. So took a year off from fellowship to get treatment. And while my like physical body was slowly healing, it was the insides that were really quite scared with the uncertainty of what the future would hold. Like, would there be recurrence? Would there be any complications related to the chemo or the surgeries that I had just had? And so there was a cancer survivor day shortly after my acute treatment had ended. And at the cancer survivor day, Dr. Stephen Hickman, who is the founding executive director for the Center for Mindfulness at UCSD, spoke on mindfulness. And it really resonated because I had a Buddhist upbringing
Mm.
and a background. And I was like, this is what I need to be practicing. And eventually I knew I had to teach it. Like, it was just a calling, and it was a very, very stark alignment that I noticed right away. And so my journey with mindfulness had a lot of different facets, and it's still ongoing. I think it's going to be a lifelong journey
Yeah.
uh, in learning. But I took the mindfulness based stress reduction class 3 times as a way to familiarize myself with the curriculum and to do some teacher training, some more formal teacher training for it. And I also took the mindful practice curriculum teacher training with Drs. Ron Epstein and Mick Krasner from University of Rochester. They're really like the pioneers in bringing mindfulness into the clinician space, I feel like, in their seminal article in JAMA in 2009. But yeah, and then that journey really melded into knowing that after being a cancer patient and having been an integrative medicine cancer patient that was also in a clinical trial, I wanted to bring integrative medicine into my practice. And so just in October of 2022, just pretty recently, I graduated from the University of Arizona Andrew Weil Center for Integrative Medicine Fellowship.
That is
So
amazing. I also think that's something when I think of you, like before you even finish this fellowship, I'm like, you embody it so well.
thank
You
you.
embody it so well. And I also want to just take a moment to really appreciate you sharing your cancer journey and hearing the age and the time experience and that lesson. And my whole heart goes to you from what you have experienced, and knowing that it's, you said it like kind of long lasting, that was an experience that didn't just happen and the memories vanish, right? That's a part of your journey, and kind of like the mindfulness currently navigating what that means, right? And for your life.
Yeah, thank you so much. And so going back to the acronyms, the AD stands for after diagnosis. So the after
Mm.
diagnosis, the embodiment, the attempts at embodiment of integrative healing modalities and mindfulness. Of course, we know mindfulness is part of integrative medicine, but and then the BC is before cancer. So that's how I
Mm.
delineate it. And luckily, I have 2 kids that actually kind of represent my 2 time points. So my before cancer child, who is now 14, and my after diagnosis child, who is now 6. And so it's
Oh.
I think in some ways it really mirrors my how my life was at and is at those time points too.
In terms of, I'm big on the societal values that lead us astray, right? Or even just put in the context of medicine, that you say it was so normalized. You were in doing the 80+ hour work weeks and the status quo of medicine. If you could go back to your before cancer self and provide a lesson at that time that you've learned now, and to all those that are kind of in that status quo, what would that lesson be?
Yeah, so many lessons. Um, I think definitely to slow down. That would probably be the first and most important lesson. Slow down, and then definitely you have to take care of yourself before you even think about caring for others. And I was not doing that before
Mm.
cancer. I can honestly say I was doing it here and there, but not consistently. And I definitely wasn't prioritizing it. I was putting everybody else's needs above my own. And it was the cancer catalyst that kind of like trial by fire in a way. Like my therapist, so just normalizing that, like after someone goes through an experience of any magnitude, if it rocks your homeostasis or your semblance of balance, like please get help. And so my therapist, I have had a couple of therapists over my journey, especially after cancer, said that I underwent post-traumatic growth, meaning like there was some traumas experienced um, in my cancer journey, and then growing from that experience and making meaning out of it and finding alignment from that experience.
Mm,
I'll share this with you and all of the viewers that I'm in a place now, 13 years later, that I can say that cancer was the teacher that I never knew that I needed.
mm. Wow. And just thinking of that term, the post-traumatic growth and the processing, like what that brings up for me is thinking about the times where we have that traumatic event, such as a cancer diagnosis, another serious illness, or what have you. And if we don't process this, if we hold it in, if we just suck it up, like the PTSD, like the challenges creating meaning from that and how different that could be. Not to say that you can't have both post-traumatic growth and PTSD symptoms, but just that necessary step that you recommended of processing. I certainly want to amplify and repeat that because I think we are told to just kind of shove everything in and like, okay, that was 13 years ago and it's still a journey and every day it's impacting people that maybe haven't experienced it or even for my own serious illness, like I was in denial that that was my life. And I kept getting into cycles of despair. And it wasn't until I just faced that like that was your life and what you've learned and how you embody the shift in slowing down and kind of living it to give it. Like I will admit that I was in the hospital in 2016 17 and then at another dire state in 2020 2021. 2016 I went right back to residency. 2017 I transferred residency and went back to residency because it wasn't like I wasn't ready to face it. Didn't have the tools. And so I find it so important. And why I keep asking like the lessons that you'd provide your past self for like the people who are experiencing that, maybe not giving themselves permission. And for me, it was this association of my job was my worth. So without it, who was I? And not having the coping skills to slow down because, it's we hear it, but what does it take? What did it take for you to apply it, to really lean in? So I am going to slow down. I know you said you had the catalytic event, but the steps that you took to kind of rewire and retrain yourself to do that.
I feel like I'm still rewiring because all of those old lessons of perfectionism and over responsibility, and even the guilt and shame from childhood, and then the emotional neglect that I experienced in childhood, all of that was decades upon decades of
Mm,
survival mechanisms. And so even just 13 years, that my I feel like my mindfulness journey is just nascent and still
mm,
ever blooming and traversing and going through peaks and valleys in and of itself. So the actual steps was probably finding alignment and curiosity
mm,
in wanting to learn more about mindfulness, and in my journey in sparking curiosity, knowing that I'm a lifelong learner, and if I had all of the resources and time in the world, I would love to get multiple degrees and multiple
mm-hmm.
and go for different fellowships.
Yeah, absolutely. Yeah.
Getting more and more and
Mm-hmm.
more, um, feeding into my prior self of achievement and worth identification, or over identification I should say, but realizing that we are all enough just as we are, we don't need any more
Yeah.
certifications. That it was really the curiosity piquing my interest that led me to actually practice it. Like I knew I wanted to do more of the integration of mindfulness into my own practice of medicine. Um, and then I also wanted to incorporate mindfulness into my life. And how I did it was really finding a curiosity and a passion for learning about it. And we can talk all we want about mindfulness, but unless you actually practice it, you can't make those changes in your neural circuitry. You can't really experience and truly learn unless you practice it, and
Mm.
practicing it imperfectly, right? It's
Mm-hmm.
about practice. It's not about um, all of a sudden reaching nirvana and becoming like this enlightened being. I think we have to normalize human imperfection. Like that is actually what makes us perfect, is that we are all.
Mm. It's ironic you say that because the first few times I tried to sit still, it was all of these negative self-talk things. And so then actually I was at your Mindful Healthcare Collective event with Kristen Neff. It was like, I was going through a lot then. It was actually just thinking back to that. I was like, it was kind of like, ooh, that was a really awkward stage, but I shut up and whatever. But it was great. It was very helpful. I still can't believe y'all got there's such a wonderful group and you've got, such a wonderful author and human to come to it. But it was the missing piece in the mindfulness was developing self-compassion. Like I think first, maybe alongside a mindfulness practice, because a lot of people are afraid to sit in stillness. And for me, it was because I wasn't safe in my own mind and body. And self-compassion first allowed me to be safe and to feel that I could come home and the home was my mind and my body.
Yeah, so powerful. Thank you for sharing that, Jillian. With self-compassion, I think that we can't separate mindfulness and self-compassion. Like mindfulness has to be practiced in a foundation of self-compassion for sure,
Mm,
vice versa. It's like two wings of the same bird. One is mindfulness, and the other wing is self-compassion. They belong together for sure.
I think we need to repeat that. Can you repeat that?
So mindfulness and self-compassion are two wings of the same bird. One
Mm.
wing is mindfulness, and the other wing is self-compassion.
Wow, that is beautiful. And even what's coming up when we're thinking about mindfulness, the resistance that I had in the beginning was we're taught, just like you said, the achievement oriented, the if I'm not being productive, then I'm losing value. And a lot of us are not even being quote unquote productive. If we define like productivity is like in alignment with your values and your goals, it's just this busyness at times and distraction and dis-ease with mindfulness. And not that mindfulness has to be a stillness practice, but just that slowing down, like where the resistance comes in for many is like, I am so used to being in the hustle, the fight and flight, the overdrive, the achieve, don't stop, that the beginning stages of that practice, and I'd love to hear what your experience was like, it can be like very nauseating or you feel the resistance and you might first feel worse, right? As your nervous system kind of like you feel the experience of having that chronically high sympathetic overdrive and then try to bring it down. What was your experience with that? Or is your experience? Like you said, it's a lifelong journey.
Yeah, so when I first took mindfulness-based stress reduction, there was definitely a lot of discomfort because part of it was that I realized during one of the practices, uh, so there's usually like an introductory, what ends up getting called the quote unquote the well meditation, where the reason for why you're in the class gets gently uncovered. And the imagery that's used is going deeper and deeper into a well, like that you're this stone and you're going deeper and deeper into the well. And as you drop deeper and deeper into the water, layers and layers of dirt start coming off, revealing the true reason why you're there in that class. And so it ended up being that my true reason for being in the class the first time I took it, shortly after the acute treatment for cancer, was to give myself permission to feel happy again.
Mm.
I had been in so much discomfort with not just the cancer treatments and the surgeries and the physical discomfort related to those treatments, but also the discomfort of uncertainty. And so, yeah, that was like a really key moment for me in realizing like why I was there. And I also want to normalize for you and all of the viewers about practicing mindfulness. Like you said, it's not necessarily a stillness practice. You can make a mindfulness practice anything that serves you. And then also with the practices that bring up discomfort, you don't have to do them. Like they are all invitations to practice. So ones that don't resonate with you, ones that put you in a state of overwhelm and fight or flight, maybe don't do those first. You
Mm-hmm.
give yourself permission to ease yourself into those more challenging, perhaps stillness practices. But you can apply mindfulness, which is simply paying attention on purpose to the present moment without judgment, anytime, anywhere, doing or not doing anything. And so these days, where I had shared my life has been full but good, I like the movement practices a lot more. So
Mm-hmm.
one of my resets in the middle of my busy clinic day is I'll go outside and walk some laps in the parking lot and notice nature, even if it's like the bushes in between the carports,
Mm-hmm.
the critters that sometimes are out, like the butterflies or the bees, and the flowers along the wall where all the cars are parked, for instance. So even within your own confines of space where you're at work, like there can be moments where you can be intentional about noticing nature. So like walking mindfully and then noticing aspects of nature for 5 to 15 minutes, depending on how much time I have left during my lunch break, has been super grounding. And that's been, I think, the foundation of my mindfulness practice these days when I'm at work. In addition to, of course, like the informal practices where I'm taking mindful breaths, like in between patients, before opening doors, even during the clinic visit with auscultating the lungs, taking deep breaths with the patient as they're taking deep breaths,
Mm.
washing my hands mindfully. So yeah, so I want to normalize that, like it doesn't have to be a stillness practice, and to give yourself permission to stay in your zone of safety when you are practicing mindfulness, because it's mindfulness is definitely not for everyone.
Yeah, and like you pointed out, it might not be for everyone at different stages of their experience, especially like, we hear a lot about somatic therapy, which I am a big fan of in context of working with someone who's experienced in trauma-based support. I feel that mindfulness and being more aware, something I've really experienced in my own awareness now is I've removed myself from a lot of online stimuli because it's quite overwhelming to get all this input in this world in life that I have now from a life that was just, 2 years ago where I was very isolated in a very medically compromised state and didn't know if I was going to make it, right? I'm processing that life now, but the people that know me now didn't know I was very alone back then. And it's a necessary part of my healing experience to reassociate with that part of myself in order for my ability, to do what you did is have post-traumatic growth. So I am learning to face it, but it was really important for me to get with a therapist who could slow me down because I'm like, I'm just going to dump myself all into this, I'm just going to do this exposure therapy or, but to be embodied in today's world where there's so much coming at us, it's a takes gentleness, right? Self-compassion to do it at a pace that feels appropriate for you and that may or may not change throughout the day and throughout your week as you get external stresses that may be additive on your own personal experience.
Yeah, you bring up a good point about giving yourself permission to pace yourself. And the pace may change day to day, moment to moment, and that's okay.
Mm. We went through that today, right? We had, when
Yes.
it comes to just knowing where our priorities, right? So just for people that weren't here, like when we're having, certain priorities that we know in our head and knowing where our values lie and what can shift and what can't, like the flexibility and not making it mean anything.
Mhm. Yep, exactly. And I'll just be open and share that that what Jillian is referencing is that I almost canceled today's session because my youngest, who has a piano recital later today, was having some pretty significant performance anxiety, and I really felt called. My instincts as a mother was tugging me towards staying present with her. But then, as she practiced her songs, and we also found the dress that she wanted to wear for the recital, which I think really gave her a boost of confidence, and maybe some control, that I realized that she was ready and she was going to be okay. And actually, this time away from uh, practicing before the recital would be a good respite, a welcome respite for her. And so here I am today. So
Yeah.
thank you for your flexibility and your willingness to pivot, knowing that like if she barges in and is quite anxious, that we will pivot and see what happens with the session.
Yeah, and it was beautiful, right? Is it was just this moving and to see how you were responding and you were really holding space for her. It was so beautiful to me. And of course, this channel used to be called Permission to Pivot, and my Facebook group is still called for Permission to Pivot. And I enjoy the capacity to pivot. Actually, it also mindfully makes me aware of an experience of my life that fed into my severe eating disorder was inflexibility, rigidity. And so um, giving me the opportunity to practice flexibility and I didn't feel any anxiety about it. Right? I'm like, wow, like my past self would have, I didn't think anything. I'm like, oh, wow, she's, it's beautiful. I love she's holding space. You communicated with me in multiple ways. So you knew that I got the message. And it gave me that ability to say like, wow, I've definitely grown in my own areas that were really holding me back. The rigidity, inflexibility, taking things personally, like none of it showed up today. So
Yeah.
thank you.
Yeah, absolutely. I'm happy to reflect that back, even though unintentionally. But I knew you would understand. Like there was not even a doubt that I'd be like that. That you would somehow take my need to cancel last minute, like in a malicious way or something. So thank you for that, for practicing flexibility with me, even
Yeah.
though it ended up being okay. And that now we're talking about that particular incident as a learning experience.
Yeah. Isn't it great? And also, I think a lot of people times, we take things on social media where this is going to be posted. I've learned over time, like I don't take anything personally anymore because I was taking everything personally. I'm like, but it's actually not personal, or what people say is a reflection on where they're at, how you respond to it, or what it brings up for you is a reflection on what's going on for you. And I want everyone to feel welcome. Like this day is about you. So like if it wasn't something that was going to work out for you, like it's not about, I want you to have a great experience on this channel when it works out for you and not a day where it feels stressful. And of course, we're talking about mindfulness. So if we got something on our mind where we can't be present, in Martha Beck's training, we talk about coming to sessions with untroubled, like to hold untroubled space, which means not that we're not going through something, but that we can set it aside and be present. And if we have things in our life where that's not possible, then we know that what you were saying about, spending time with family who are going through things, like not to say that we should put all of our troubles aside. Sometimes those things need our direct attention. It's those other things that we have to remove from our plate.
Yeah. And we have the choice and agency to do it, even though perhaps prior conditioning made us think otherwise.
Mm, yep. We have agency to change our thoughts and challenge the narrative.
Absolutely.
So you and Jesse make a dynamite team, and I would love to talk more with you about your podcast and your retreats.
Well, yeah, the origin story of Jesse and I also originated from EWP, Empowering Women
Mm,
Physicians. Dr. Sunny Smith, who she and I also have an origin story of sorts that's kind of fun to explore. So she and I had worked in parallel for years at the UCSD Free Clinic, and she had referred to me, and I had referred back to her for primary care issues that our patients were experiencing. But like we had never gotten to know each other, like we knew of each other, but it wasn't until a med student panel that we were on describing our own challenges as patients and healers that we really got to know each other
mm,
very deeply on a very intimate and vulnerable level. And so when she set forth her vision of having a Bora Bora retreat, and I've always wanted to go to Bora Bora, I was like, yes, 150%, yes, all in. And then Jesse also ended up coming on this retreat. And so we
mm.
actually met at SFO airport in San Fran on
Amazing.
Bora Bora. And and even before then, Jesse recently reminded me I had actually met her before, which was at the Brave Enough conference
Mhm.
by Dr. Sasha Shilcutt, who has also been instrumental. I also credit her as being one of my sponsors in terms of giving me space and a platform to share my story and be less afraid to share my story.
Mm.
So I had a pop-up little mindfulness shop with like mindfulness books and mindfulness journals and jewelry um, and Jesse actually had come to my pop-up shop like years before we had met in Bora Bora. So while my memory was that I had met her in Bora Bora, she reminded me that actually we
Mm.
years before. And so along different parts of our entrepreneurial journey. So yeah, I think it's been so fortunate and so such a great experience to have someone that you can lean on because we have different seasons in life. So when one of us is a bit more busy and doesn't have time to record, or um, we're kind of desynchronous in our like level of inspiration and then want to record, there's always ways creatively that we can work around that and still put out quality aligned content um, that also feeds us as well, so that we're not just constantly giving like my BC self was from before. And so I'm super grateful for that special relationship that I have with Jesse. And we have put together the Mindful Healers Connect in Nature retreat. This will be our third year running that at the Green Gulch Farm and Zen Center in Muir Beach, California. And there's an incorporated part where we go into Muir Woods and we go early in the morning. So oftentimes we're the first people that set foot in Muir Woods for the day on a Sunday morning and practice mindfulness. And it's really, really special. It's just magical to be amongst these ancient living beings, the majesty of it all, and the tranquility that Muir Woods provides. Um, yeah, so it's a special time, and thanks for letting me share about it.
Yeah, I'm certainly going to put the information for both the podcast and the retreat down in the description below. I can also put the EWP Facebook group for women physicians who are interested in learning more. Ironically, I was just at the EWP open house today before this call, and I really valued, I did EWP in 2022, the coaching program, and the amount of community and connection and people, like you're just saying, you highlight, the vulnerability, I think, really cultivates and allows for those deep, genuine connections. And I find that in, as being a professional woman of any sort, or a professional in our society, or just being out in our society, we have to hold so much in, right? And we have to have this certain persona where we think if we show up a certain way, we show up with our emotions, it makes us appear weak. And sometimes I find that people are oppressed and judged. I've been experiencing that in my own academic endeavors and being a coach within an institution where many themes come up. And it's not only a perception that's in our brain, like it's a reality that women are oppressed and looked down upon. And a lot of us associate women with being more emotional. Like we can still experience and express our emotions. And I invite them, and to have a space where you don't even have to consider how it will be received. I want to say how it will be judged, but it won't be judged. Like that's the point. So I'll put that Facebook group down below, and also the EWP coaching program information.
Yeah. Yeah, so important to have a safe space where you can authentically be yourself and share whatever it is and know that the support is unconditional and oftentimes resonant with others. Just the fact that you're even sharing can help so many others too.
Yeah, I think that's what you create. And your retreat thinking, I think Jesse's do you all do forest bathing on this retreat?
Yeah.
Yeah,
Pretty
it's I got that concept from her, but just knowing you both and that the safety and sometimes people call it brave spaces, knowing the people that may have just be meeting you now and they can watch more or listen more to your podcast. Again, another thing that you embody. It's like I feel like I can show up whole and authentic and share anything with you, and it's deeply appreciated.
Oh, thank you so much for trusting me with that.
Yeah. And for the listeners today, what would you like them to take away from our discussion?
I think the takeaway from our discussion is to get curious about your own mindfulness and self compassion journey, wherever that may be, and to meet yourself where you're at. If you're new to mindfulness and self compassion, I certainly invite you to try aspects of including more of that in your life and be open to seeing what happens.
Are there any particular resources that you would point them to as they're starting their journey?
Yeah, absolutely. So, for healers who happen to be watching your channel, we invite all healers to join the Mindful Healthcare Collective Facebook group, and you can sign up for our free emails at list the events at mindfulhealthcarecollective.com. My own website called awakenbreath.org. Under resources, I have videos and also audio recordings that are freely available for mindfulness practices between 1 minute and 45 minutes long. So there's something in there for everyone. And then also 10% Happier podcast, the Calm app, Headspace, and Insight Timer. Those are some of the apps that I've recommended for the healers that I've worked with and also my patients. So get curious. There's so much out there. See what resonates.
Mhm.
You're going to have preferences in terms of the different types of practices that are offered and even the durations. Um, and know that you don't necessarily have to uh, practice in a way that is what's expected, but rather inviting you to choose to practice in a way that serves you, whatever that looks like.
I love it. And to repeat what you said previously, like the imperfect practice, expect it to be imperfect. Well, I deeply appreciate you. And I will share all those resources that you said. And you've got your website, we've got the podcast. Where's the best way for them to connect with you?
Yeah, you can check out my website at awakenbreath.org. You can email me there. But also at the Mindful Healers podcast, you can hear either me or Jesse or both of our voices every week. We usually release on Sundays.
Perfect. It's beautiful, and I highly recommend it. So thank you again, Ni-Cheng, for being here. I loved our discussion today.
Oh, thank you so much, Jillian. Deep bow of gratitude for all that you bring to this world and your being and your beautiful, vulnerable sharing. And thank you so much for your work.
Yeah, likewise. I would repeat that right back to you. Feels inauthentic to just steal those, but I certainly would reflect that right back to you. And for the audience, please share your thoughts, your reflections, your takeaways. We always love to hear from you. And until next time, thanks for being here.